Assalamu alaikum. Welcome back to all of you guys in Internal Medicine OSPE Stations Section 2 presented by MedDesk. On station number 1, we have a chest X-ray and there are 3 questions. Question number A, describe this X-ray chest. Question B, what is the most likely diagnosis? And question C, give 3 complications that this patient can develop. As you all know, uh, that on the previous chest X-ray, there is homogeneous opacity in right and upper lobe with air bronchogram. Question B was what was the most likely diagnosis in the chest X-ray, and that is you all know that homogeneous opacity. It is basically a clinical presentation of lobar pneumonia of right and upper lobe. Third question C was that what are the complications of this diagnosis. We have mentioned only 3 complications. There are more others, but you have to remember just few in case of OSPE: empyema, lung abscess, and sepsis. So station number 2 is describe this ECG. Uh, and what is the most likely diagnosis, and what are 6 possible complications of this disease. Please look at this ECG diagram, and you know these are the precordial chest leads, and there is ST elevations. So basically we have to describe this ECG in terms of rate, rhythm, and its axis, and what are the abnormalities, and what are the reciprocal abnormalities in this ECG. So rate is when we calculate, that is 75 per minute, and the rhythm is sinus, and the axis is normal. And as you have looked into the ECG, there are significant ST elevations in interior and lateral leads, and this is anterolateral MI with significant Q waves in anteroseptal leads and reciprocal changes in inferior leads. And the most likely diagnosis is, you know, that is anterolateral myocardial infarction. And what are the 6 complications? I have mentioned 8 complications. You can remember 6, and you can also remember the others, but you have to mention 6 or more: congestive cardiac failure, arrhythmias, aneurysm, valvular incompetence, Dressler syndrome, 6, pleural effusion, cardiogenic shock, and post myocardial angina. Now on the station number 3, there is again an ECG. Look at the ECG. You have to make its diagnosis, and you have to manage this patient if his blood pressure is 70 by 40 millimeter of mercury. Look at ECG, guys, and you have to make a diagnosis. When we describe this ECG, basically it is SVT, supraventricular tachycardia, and there is form of it is atrioventricular reentrant tachycardia, and this is the diagnosis. And when we describe in question A, the rate is 150 per minute, rhythm is not sinus, but the axis is normal. And when we look into the P waves on the ECG lead, basically P wave is absent, and the QR complexes are narrow as compared to the normal ECG. So how will you manage if its blood pressure is low, 70 over 40 millimeter of mercury? We use synchronized cardiac shock. So uh, In every exam there are many non-interactive stations, and 2 to 3 hours are interactive stations, like in final year MBBS or in FCPS. So we have now an interactive station. 27-year-old boy has presented with diarrhea for last 4 months. Ask him questions related to his complaint which can help you in reaching at his diagnosis. So what questions we will ask from a patient who has diarrhea from last 4 months, means chronic diarrhea? We will ask him about frequency, consistency, and whether there is blood or not in stool, tenesmus, urgency, whether he has abdominal pain or not, any fever, any improvement with fasting or aggravating weight loss, is there any drug history in past 4 to 5 months, is there any abdominal fullness or bloating, whether he has steatoria or not. So basically, these are the questions which we will ask him in history. Again, there is an interactive station. 23-year-old lady is diagnosed to have positive anti-HCV on routine examination. She is worried about her disease. You can ask questions related to her disease if needed. You need to advise her further plan along with precautions she need to take in her daily life. History of transfusion, history of tattooing, history of any surgery, history of any family history of hepatitis C, history of any IV drugs or any drugs she has taken till now. She needs tests like HCV RNA by PCR. She also needs CBC, LFTs to look for any liver damage, ultrasound abdomen to look for any kind of the liver parenchymal injury, to and fibroscan to look for the cirrhosis or any fibrofatty changes. She also needs a test for hepatitis B surface antigen. She needs treatment with sofosbuvir and valpattacivir for 3 months. She needs to separate items of personal use in home. Otherwise, she can spread this to others and family members. And there should be testing of family members also. She needs to clean drinking water and she needs hygienic food. Station number 6, there is an instrument on the table and we have to name this instrument. Question B, enumerate its 5 indications. Question C, name 2 ways of ensuring its correct position. Please guys, look at the table. This is endotracheal tube, and the most authentic point is endotracheal tube but with cuff. Examiner can give you 2 points, otherwise he will give you 1 point. Question B, these are the indications of endotracheal tube with cuff: unconscious patient, skewing airway and GI bleed, need for ventilator support in GA, airway suctioning following aspiration. So how we have to confirm its position? Air entry in both lungs with stethoscope. You have to listen it. Wave form capnography. This is another method to confirm its position. So on station number 7, we have a drug. As you know, this is Lasix injection, this is furosemide. Name 3 diseases where it is used for treatment. Question B, enumerate 3 contraindications of its use. And question C, write down 4 side effects of this drug. As you all are well aware of this drug, basically Lasix furosemide is used in volume overload in CKD patient, chronic kidney disease, in ascites due to liver cirrhosis, and in congestive cardiac heart failure. What are the contraindications of its use? Hypotension, hypovolemia, we don't give it. In hyperglycemia, we also don't give it. If there is diuretic hypersensitivity, means diuretic allergic reaction, then we don't give it. If a patient has ventricular arrhythmias, we also don't give furosemide. What are the side effects? Most important are hearing loss, tinnitus, hypocalcemia. Others are muscle cramps, dehydration, hypercalcemia, hypocalcemia, hyperglycemia, hyperuricemia, and hypertriglyceridemia. Basically, um calcium goes down, but glucose, uric acid, and triglycerides, these gone up. And patient can also suffer from headache and dizziness. Again, there is interactive station. uh, you are in a shopping market when a 55-year-old man has collapsed in front of you. How will you respond in this situation? This is important station. Basically, we have to make sure of scene safety. We have to tap and shoot, call for help, and we have to check for breathing and pulse for 5 to 10 seconds. But main important thing is call for help. Activate emergency response system and call for AED device. High quality CPR. 30 by 2 ratio means 30 compressions followed by 2 breaths. Compression rate should be 100 to 120 per minute. At least 5 centimeter depth of chest compression should be done. And there should be complete recoil of chest with the minimum interruptions in compressions. This is the most important point. Question number 9. We have a CT scan which shows any abnormality. Name this investigation, what are the positive findings, what is the most likely diagnosis, and name 3 causes of this disease. Please guys, look at down in this CT scan. This is CT brain without contrast, and we have a white lesion in CT scan. When there is white lesion in brain on CT scan and the surrounding area is dark, means that white lesion is hyperdense. So a large hyperdense lesion in right frontal and basically in temporal lobe with evidence of compression and extension into the ventricles. So this hyperdense lesion is basically intracerebral hemorrhage. And what are complications? Hypertension. And what are the associations? Basically these are hypertension, AV malformation, and aneurysm rupture. And this is the last station. We have an arterial blood gas report where pH is 7.10 means acidosis, and we have CO2 partial pressure of CO2 25 millimeter of mercury, and we have low bicarb means it's metabolic acidosis. What is the diagnosis of this acid base disorder? Numerate 5 causes, And how do you treat this disorder? So as I have mentioned that this is metabolic acidosis. And what are the causes? Diabetic ketoacidosis means DKA. Lactic acidosis, as you all know that metformin causes lactic acidosis, but it's rare. Uremic acidosis, severe diarrhea can cause metabolic acidosis. Renal tubular acidosis, RTA, it has 4 types. Salicylate poisoning. So we have also other causes, but I am not going into depth of this metabolic acidosis with normal inine gap or high inine gap. And the third point is, how are we going to treat this condition? We have to treat the underlying cause. Means if metabolic acidosis is due to the DKA, we have to treat DKA. Metabolic acidosis will be corrected. We have to give sodium bicarb if indicated. So guys, these are again the 10 stations of internal medicine OSPE. Basically this is section 2. In next video I will make section 3, and you all know that these OSPE stations are very important for your clinical exams along with your clinical examination. Please support us on YouTube channel, subscribe us, and make sure that you will get the next videos. Thank you.